All right. So, hi, good evening, everyone. So, I have one of the brightest star of the evening. So, today, you all know we have got the results of the FMG exam, and I have with me Dr. Yogesh, who has now successfully qualified the FMG exam. So, many congratulations, Yogesh.
Thank you so much, sir.
So, Yogesh, I can understand the feeling as of now would be definitely, the next level. But
Uh,
then it is the time that once you have now qualified the exam, it is a time that you should guide all the other students will
sure.
be appearing for the exam, next time after like 6 months. They will be coming up to India and will be preparing right now for the exams. And also, we would like to listen from you about your journey, how it has all started. So, Yogesh, I would like you to tell about yourself that how you have pursued your MBBS, how you have like started preparing. So, starting with your MBBS part.
Yeah, actually, I'm coming from a middle class family, but I'm not a big dream having a big dream of becoming doctor. But somehow I got into this path and choose the career as to become a doctor. So successfully, I became a doctor right now because of teachers like you and many of them. So actually, I graduated from Gulas College of Medicine from 2022. I have been preparing for last 1 year. I am not that much a bright student in my college, but I somehow studied and passed this exam with help of like your mock test and many other. I actually the main target of the exam is to check how you will be doing your part in clinics, not in like in not in your clinic. Only your clinical way is main for the exams. So you should every doctor should have that clinical application of the what you study. That is the main important thing for everything. Like now the NMC is getting day by day, it's becoming hard to get and pass the exam.
Absolutely correct.
Yes, sir.
So, Yogesh, now once you have done, if I'm not wrong, your marks are like 167, correct?
Yeah,
You
yes,
have
sir.
scored 167. So
Yeah.
that's pretty good score, and you have done, pretty well in the exam. So please tell me, how did you started your preparation? What all video sources from the eGurukul, the DBMCA part you have
Yes.
used, and how you were strategizing your things? Like after
Yeah.
that, everything that you started, like when you started the preparation.
Yeah, actually, I when I was in Philippines itself, I started studying. At that time, it was like my last 1 month in Philippines, but I should be enjoying that time, but I stopped enjoying there and started studying there, studying from there itself. But I couldn't make it in last attempt in like in January 2023. I got only 125 marks. I started to see many videos, many from many websites, many YouTube channels, and many things. But then DBMCI, I saw some videos of Dr. Pankaj Tikku sir, Saurabh Bhatia sir. It helped me a lot. That too in pharmacology, it's very hard thing to study and know to learn the drugs. It helped me a lot to know about the drugs and medicines of pharmacology. And Pankaj Tinku sir's pediatrics also it's a very good. And especially the mock test of DBMCI is a very great. It will be very difficult in be a very difficult level when compared to an MCI, but it helped me a lot to know about the topics which I missed while studying also. And it is a very great thing. Like DBMC is doing a great job in doing the mock tests, conducting the mock tests all over the India.
Okay, fine. So, it was your second attempt. It
Yeah,
was
yes,
definitely it was not a very good feeling in the very first attempt to get like just short
yeah,
25 marks short of the exam, and
yes,
now you have successfully done it. Wonderful. So,
yes.
how close about the mock test that you had from DBMCI? How do you think like how equivalent the mock test of DBMCI were to the real exam of the FMG?
Yeah, that's what I was before saying. It was not equal. It is a way higher than the MCA, but it will surely boost your confidence to like we should achieve more marks in the this exam. That will boost your confidence while attending the real FMG exam.
All right. So, any special names, any special faculties content that you think was like, the gold standard or maybe something very beneficial for your these exams?
Yeah, that's what I like. Pankaj Tinku says, and I have saw some videos of your videos also, and then Saurabh Bhatia sir, like that one. It is very helpful for me to get the marks.
Perfect.
The exam.
Wonderful. So what would you like to tell the students who will be now appearing for the exams? After 6 months, we are going to have another like 5 months or 4 months.
Yeah.
So we have
Yes.
another exam. How do you think the strategy should be? Like when to see the videos, after the face-to-face class, after the live class, recordings versus live, all the time the students are trapped
Yeah.
here. Should it be recording or live? What is your
Actually,
recommendation?
my way of studying is I like to watch the videos repeatedly. Like I have watched some like anatomy and surgery videos. I have watched more than 6 times in last 2 to 3 months, in last 2 sessions. I have seen many videos like 4 times, 5 times, and somehow some students will like to read and write. So it is there. First, they should know like what they like to study, like how to study, like write and study, or watch the video and then study. It is depend upon them. After that, they should prepare and schedule. Like they should studying for 10 hours, and then they should step by step increase their studying hours up till we can study 14 to 15 hours. But what I say is like 13 hours a day is enough. 13 hours and 2 hours for practicing the MCQs. Daily you should practice MCQs. MCQs will solving the MCQs will definitely boost your marks in the exam. That too, not you should just mark and go. You should mark the answer question and then mark the answer, and then you should see the explanation, because the explanation will tell you where did you make the mistake. That's the MCQ solving is a big art that should be done every day without missing. You should skip a meal, skip a sleep, anything, but you should not skip doing MCQs.
See, one of the common thing that I have seen in the FMG student is they try to mug up some of the things.
Yeah.
I'm not able to understand, so let's mug it up. We'll find
Yeah.
some way. We'll make some mnemonic. Is it a good idea? What do you suggest? Mugging up or
Actually, we should like in small subjects, like I will not separate small subject or big subject. Every subject is equal for the doctor. But if it's come to up to an exam, means if it is okay to segregate the hard tick and easy thing. In easy thing means you can just go with the rapid revision. It will be like anesthesia, derma. It is only five marks only. But 1 mark, if you ask the student who scored 149, he knows the pain of the 1 mark. That 1 mark also very important. But if you having a hard time in recalling the anesthesia, doing a rapid revision, it will be an easy thing. And mugging up will not be no longer it will be helping, because NMC is changing the pattern of the exams, changing the question types. Some if you're doing the MCQ also, they will do like just read the question and mark the question. They will just know the answer. That's why I'm telling you should know the explanation. If you know the explanation only, you can. If they try to ask the questions in different manner, it will be easy for you to mark the answers in the exam.
100%.
Yes.
So, what is the plan, Yogesh, now? After the
Right.
marks are out, so
Yes, sir. Yeah, I'm actually feeling very happy and excited. I couldn't believe that I passed the exam, but it happened. As of now, I'm just planning not to do anything after doing my internship, maybe doing the PG course.
Wonderful. So, Yogesh, once again, many congratulations from the whole DBMCI family.
Sure.
And I'm very happy that we have played some little support for this happy journey.
Little support is a big support.
No, that is our duty and responsibility. No, so once you are out of this, exam, it is a very happy news for all the DBMCI family members here. Okay,
so you should DBMCI should conduct many mock tests like this.
100%, definitely, 100%. We'll definitely plan for that. Sure. And now you're welcome to this world. Have some holiday time, have some good time, and then get back to the, get back on the track and start preparing for the next part.
Sure.
Okay. Sure. So all the very best, Yogesh. Thank you so much for being with us.
Thank you, sir. See you.